So this is a co-authored paper with my graduate students, Jasmine Jackson and Michael Strawbridge. Jasmine is a student here at Purdue who just defended, who just defended her dissertation prospectus. So she's now a candidate. We're super excited for that. And Michael Strawbridge is now at Rutgers. We also want to acknowledge the excellent work of Millie Jha, who is our undergraduate research assistant, and she is the recent Caputo awardee. So we are super thrilled and honored to be working with Millie and are grateful for her time. So we research we're looking at the effects of COVID-19 on the Black community. And this initial quote here by Barbara Lee is really instructive. And I'll turn a little bit back to this towards the end, but I want to just kind of set the stage or frame out the work that we're doing. So we are largely in conversation with a 2019 piece published by Alvin Tillery in Politics, Groups, and Identities, where he uses Twitter data to analyze the ways that members of the Congressional Black Caucus talk about race and racism. And what he finds is that Black women are most likely to tweet Black Lives Matter and to communicate with their constituents around Black Lives Matter issues. And we thought, given the COVID-19 struggles of Black communities that are being affected at disproportionate rates, would this be true too, right? Would we see Black women more likely to take on this mantle of communicating about race and racism during COVID-19? Although, right, members of the Congressional Black Caucus represent equal amounts of women and men, but we're seeing in their largely majority minority districts, but we're seeing this distinct pattern. And although we are seeing this pattern, we're going to kind of walk you through this in our paper. But I think that this quote here by Barbara Lee, representative from California, stating that we have a pandemic upon a pandemic in the African American community is really telling. And I'm going to play this clip. But what she's referring to specifically is the role that racism plays as one of the failing tenets of American democracy, that there are members of American communities that are not fully recognized as human. They don't have the same set of resources or skills or ways to access healthcare that other Americans do. And for her, right, and other members of the Congressional Black Caucus, this is a real travesty of the American Democratic Project. So let me play this hearing for you.
Is very, very timely. First, let me just say, and I think everyone recognizes we have a pandemic upon a pandemic in the African American community. And so today, I just want to take a moment to offer my condolences to the Floyd family as we mourn and grieve his loss and hope that justice is served in his memory. And that goes right into the disproportionate rates of African Americans and people of color who are dying from COVID-19. Now, Dr. Redfield, the PPP and health.
So here you see that she is making direct reference to the murder of George Floyd that happened on May 25th, 2020, that set off our summer of racial reckoning. And so while Americans are seemingly disjointed of our understanding of COVID-19 and racial injustice, this is the project that the CBC is putting together, right? They're connecting racial justice to health insurance, healthcare, health equity issues that have these myriad effects in other parts in American democracy. So that today will set the tone for our project and our presentation. So we draw from literature in race, gender, and political communication. And what previous research and some that I've done with Sarah Allen Gershon that we've been published in C-SPAN archives, edited volumes, show that members of Congress use their hearings on the floor to really communicate to constituents. So they're signaling to constituents issues that matter to them, and then how the legislators are talking directly to these issues. We also know that women of color members of Congress are more likely to talk about women's issues than their male counterparts. And the same thing for Black members, that they are more likely to talk about racialized issues. And for these, right, racialized issues and women's issues are very, very distinct in political science literature. Women's issues are most likely around children, healthcare, education, and jobs, and women's reproductive rights. Black issues are racialized things around civil rights and racial justice. But doing an even further dig, we find that Black women lawmakers are more distinct than these just two distinct categories of men of color or white women, and that Black women lawmakers prioritize education, healthcare, economic development, and employment issues in these really key and distinct ways, that they are more likely to talk about these issues as affecting Black communities. Black men are more likely to support racialized issues than gender, and that Black women members of the Congressional Black Caucus are more likely to use Twitter to discuss racialized issues, namely Black Lives Matter. This is the study I mentioned on the onset by Al Tillery. So turning our attention to the Congressional Black Caucus, we want to remind folks that the Congressional Black Caucus was formed in 1971 after the first sizable cohort of Black lawmakers to enter Congress after Reconstruction, right? So really what's put into place are that Black members become elected once the Voting Rights Act takes place in 1965. We get our first sizable cohort of Black elected officials in 1968 and 1970, who at this point, right, were part of this Democratic Select Committee. And when larger numbers of them entered Congress, they decided to form the Congressional Black Caucus. The Congressional Black Caucus has had a very sizable impact on the kind of representation that Black communities have seen. Early in Black politics within institutions, scholars sought out to see, do having Black members really change representation and change the kind of issues and agendas that are set for Black communities. And in the early 1990s, there was large numbers of studies and debates saying that could a white Democratic representative do a great job representing Black constituents the same way that Black constituents would do. And what resoundingly has scholarship has found since the 1990s is that having Black legislators make a sustained difference, right? That they center the issues that affect African Americans, they prioritize the kind of policy preferences of their communities, and they can do so even without, they can do so by moving up in party politics, they can do so by having leadership positions in the chamber, and they have done so in ways that are distinctly different than white members who used to represent these same districts. Also, it's important to note that since the 93rd Congress in the 1970s, that the CBC has grown by over 300%. The majority of the members of the CBC are Democrats. There have been Republicans. To date, there are no Republicans in the Congressional Black Caucus. So in some ways, right, the Democratic Party is overly represented in the Congressional Black Caucus, although membership as a Democrat does not prohibit one from joining the Congressional Black Caucus. So in our study, we draw from the C-SPAN video library, and and this is in some ways, right, it's difficult because the pandemic is still ongoing and there are continuing hearings on coronavirus. So we've had to cut off our analysis, and MJ, my co-presenter and co-author, will share more details with you. But we draw from, in this paper, 97 House hearings that use the term coronavirus disease. And we use the transcripts from the hearings that were provided by C-SPAN, and then we further analyze them using thematic analysis. And from that thematic analysis, we sought out to find what were some of the prevailing characteristics of the members' conversation, and we broke them down into these four main themes: underserved populations, health economy, and then this targeted group on Black women. So MJ, I'll turn it over to you to talk about the quantitative data and methods.
Thank you. Yeah, I think I'm on now. So on the quantitative side, we use two independent coders, and our quantitative analysis treated each individual speaking segment as its own unit of analysis, so that every time each question they asked or each time they gave a speech, it was broken up by someone else speaking, then that was a new unit of analysis for us to analyze there. We noted first the types of hearings we looked at. Was the hearing one about disparities? Was it a hearing about racial disparities in particular? We didn't have a third one indicating if a hearing was about Black racial disparities, just because no hearings specifically titled that. We also made sure to remove all procedural statements. Because these are congressional hearings and meetings, there's a lot of formalities. There's a lot of I yield, or you're now recognized, thank you for your time, good mornings, and things of that nature, especially because we're using a lot of virtual hearings. There are especially a lot of times that you just had statements that were not helpful at all because they were just talking about, please unmute yourself, or I can't hear you, can you hear me? So we didn't want that to skew our data results, so we removed all of those. What we're left with were 1,905 speaking segments from 49 CDC members, over 87 hearings in total, 10 of our 97 hearings didn't include members of the CDC. And what we were analyzing were three criteria. First, was it a mention of disparities? And this included all vulnerable and marginalized groups, including where this veterans health crisis, the elderly in nursing homes, Black and brown or racial disparities, but just all encompassing groups, including essential workers being at a higher risk of contracting the virus. We then, at a second dependent variable, looked at racial disparities, and this included any minority population and the disparate impacts that they're experiencing during COVID-19. And then third, we noted references specifically to Black racial disparities. Because we're using count data, we referenced Tilley 2019 in a similar way that he dealt with the overdispersion of data using a binomial regression. We also use several relevant political factors unique to each individual member of Congress, each CDC member, and their district in total. Go to the results now. Yeah. So before getting into the actual differences between the men and women of the CDC, we saw that just the members talked about 5 really broad topics: government response and oversight, racial injustice, housing and economics, education, and health and available resources. Unsurprisingly, the most common topic in hearings about COVID-19 were health and available resources. But what we see is there are other important topics that the members addressed in the hearings. In particular, the racial injustice was one that came up, and it often came up mainly between the end of May through the end of June, right around the time of George Floyd's death, and we saw the rise of protests and everyone discussing it. We saw members like Barbara Lee earlier managed to tie in George Floyd's death and the actual COVID-19 facing the African-American community, and we saw how they showed the connectedness of those two events. In terms of actual disparity rhetoric, the members of the CDC do in fact discuss the disparate effects of COVID-19. 40% of all their statements address the disparate effects. 438 discussed all disparities. 216 discussed racial disparities, and 127 specifically addressed Black racial disparities. And the number of Black racial disparity comments is not surprising considering that they are the CDC and that their focus and who they are historically known to represent is the Black community. But now we look at the gender differences between the CDC men and CDC women. Due to our sample size, as Dr. Brown mentioned earlier, we didn't produce any statistically significant results. We largely credit that to the fact that we were analyzing 1,000 statements. For comparison, Tilley 2019's paper with Twitter, it analyzed 20,000 tweets over the entirety of the 113th Congress. We analyzed 1,000 statements in a 5-month period. So instead, we look at the substantive meaning of our coefficients and what we can take from those as far as the presence of those same gendered patterns that others have already found. We transformed our regression coefficients their incident rates to better illustrate the differences between the men and women. What we see looking at that first row is that being a woman in the CDC makes you just slightly more likely to discuss all disparities. But at the same time, with race and Black disparities, we see something interesting. Being a woman makes you 0.85 times less likely to address racial disparities, but also 1.07 times more likely to address Black racial disparities. And we run these same regressions now accounting for the type of hearing, we produce very similar results. So we see that this isn't just the result of being in a specific type of hearing, but that the Black women are speaking in a very unique way about race and COVID-19. In particular, what we see is Black women, they aren't discussing racial disparities in terms of addressing everyone. They're targeting the Black community in their comments. Meanwhile, the Black men apparently are discussing racial disparities in a more broader sense, encompassing all racial and ethnic minority groups, showing how there's a difference in who the Black community is speaking, who the Black women of the CDC are speaking to versus the Black men. We further see the results. Go to the next slide. And table 2 just shows the breakdown between the Black women and Black men in the CDC as far as who is talking about disparities at all. Every woman of the CDC discussed disparities, while every man did not. In terms of racial disparities, 8 out of the 26 men of the CBC did not discuss racial disparities, compared to just 3 women. And 9 out of 26 CBC men did not discuss Black racial disparities, compared to only 4 Black women who did not. What we see then is that not only are Black women speaking in a more targeted way, specifically addressing the Black community in their rhetoric, but also it's a more collective effort by all the Black women of the CBC compared to a more segmented effort by the Black men. But we now turn to our qualitative analysis, which Dr. Brown will discuss, to better flesh out these patterns.
Hey, thanks, MJ. So the general approach that the CBC members all took were recognizing that there's grave disparities around race. So this is a quote from Lauren Underwood, who represents a non-majority minority district. She is one of 3 Black women in Congress that do so. So I'm going to play the clip for you. And again, this sets the overarching view of how the members of the CBC are viewing the pandemic right now.
Well, we know that during times of disaster, whether it's healthcare disasters and emergencies, economic disasters and emergencies, it's the vulnerable population that see disparities get exacerbated. We want to make sure that our homeless veterans are being cared for and taken care of and are not experiencing disproportionate disease burden or related impact. Thanks so much for your leadership and for being with us today. I yield back.
So it's key.
Thank you, Ms. Underwood.
Oh, let's turn that off. Okay, so it's key that she's really highlighting vulnerable populations. And so although the distinct example here is about veterans, what we see throughout all of the CBC members' conversation is this plight to represent vulnerable populations.
I see.
This is a quote from Maxine Waters, and we don't have a video to accompany this clip. But what she's saying here is she's really pushing us to think about the have and have-nots and digital divide, and how this affects particularly marginalized communities that are Black and Brown. And so this quote here, she says, when we're looking at technology, including digital contract tracing and dealing with various social distancing protocols, historically, Black and Brown people, they've already been socially distanced through segregated housing policies like redlining, systemic racism. The economic opportunities and the pandemic highlight the current injustices of our economy for people of color. So she's asking this very pointed question: what consideration should digital contract tracing take to ensure that minority communities are served well by these app-based solutions? Another thing that we're seeing that the women of the CBC are doing is they are not just making blanket statements; they're asking pointed questions to the officials, particularly from the bureaucracy, that are coming in to testify about COVID-19. On our major issue around health, we find this clip from Robin Kelly from Illinois to be really poignant. Here she kind of focuses her conversation around medical research that has shown that there are implicit biases that medical professionals have when treating marginalized communities, particularly Black and Brown communities. And so I'll play this clip for you.
Testified today. A 2003 national academic study found that even when controlling for barriers to care, minority patients have worse health outcomes than white patients. The report found that both explicit and implicit racial bias contributed to these worsened health outcomes. As we all have heard by now, minority communities shoulder a disproportionate number of COVID-19 cases and deaths. This is compounded by pandemic-related shutdowns and layoffs, hitting minority communities especially hard because we're the essential workers. These parallel economic and medical crises are a recipe for stress, anxiety, and grief within the community of color. Yet too often these same communities lack, as you know, access to care and mental health services. Dr. Evans, how can we address disparities in access to mental health care and treatment for communities of color? To testify today.
So I'm going to stop there in the interest of time. But like Maxine Waters, right, she's asking a very pointed question. So one of the only men in our study, we see Lacey Clay. We saw also a clip of him in Allison Novak's presentation. But here he's, and the other men in our study are really pushing around issues of the economy, which is a traditional masculine trait issue. So Lacey Clay is asking about racial and gender discrimination in the COVID relief packages.
The racial and gender wealth gap has been a persistent challenge for this country and has increased over the past 50 years and limits the ability of would-be women and minority entrepreneurs from starting new businesses. And according to a racial...
So I'll move on to the next slide. And this is, Ayanna Pressley is the only member of the Congressional Black Caucus in our time period, in our data set, who talks specifically about Black women having a disproportionate effect of burdens placed on them due to the COVID-19 pandemic. So she's talking about renter insurance, insurance made for renters not to be evicted. Let's play this one.
Right around the corner. Thank you. And we know the burden of this eviction tsunami will disproportionately fall on Black renters, Black women in particular. In my home state of Massachusetts, Black renters are almost 2.5 times more likely to have an eviction filed against them, while Black women are 3 times as likely to have evictions filed against them that are ultimately dismissed, a stain that remains on their credit report nonetheless. In fact, today, a study from City Life Leader Urbana found that almost 80% of the Boston eviction cases currently suspended by the moratorium are in neighborhoods of color. Secretary Donovan, many renters covered by the CARES Act still face illegal evictions. How likely is the average renter to know their rights against their landlord?
So this very poignant question, again, something that we're seeing from the members of the Congressional Black Caucus, but Ayanna Pressley is the only one that gets specifically detailed to ask about Black women as a protected group. So to conclude, right, our study distinctly shows that the members of the Congressional Black Caucus see themselves representatives for Black communities. They're using these hearings to also communicate to their constituencies that they are fighting for them and that are asking directed questions around race and racism. They're also highlighting these anti-democratic practices of racism and inequality as being part and parcel of the American political project, and that we're only seeing these disproportionate effects of COVID-19 because racism has been the underlying factor that's contributing to these disparities and these great levels of inequities. Lastly, for my part, I'll turn this over to MJ, that Black women are more likely to speak directly about the virus, and they're doing so in rates that are disproportionate to their male counterparts. So we're not trying to argue that Black men are not effective legislators. They're just having a different strategy, a different rhetorical strategy than the women. And so what we are arguing in line with Tillery's paper is that instead of looking at the CBC as a whole, perhaps we're missing the nuances by not having a gendered analysis and seeing if there are differences in how women and men of the CBC are communicating to their members.
Yes, and just to build off of that, it's just so important that we recognize and understand that our study right now focuses on events happening during an ongoing pandemic. The pandemic, unfortunately, has not stopped, and we are not near the end of it anytime soon, apparently. But what we're seeing is through April through September alone, we're seeing very similar patterns to what we've seen over 2 years as far as gender differences between the CBC men and the CBC women. And what it suggests is continued analysis that's using the same kind of strategy, these same methods, but over larger periods of time as the pandemic continues and congressional hearings continue, of just looking at the CBC and how they're addressing COVID-19. Because like in general, when it comes to all issues, it appears that the CBC women, as Dr. Brown stated, are speaking in a more direct way, in a targeted way about the Black community and also Black women, such as Ayanna Pressley, while the Black men just oftentimes are speaking in a general way. And as we look at that over time in all hearings, it's so important to just keep doing this work, using Tillery's research to build from there.
Okay. Thank you. And we're looking forward to discussing comments and then really discussing with you all about the next legs of this research.
Okay. Thank you so much, Nadia and Michael. So now let's turn back to Matt, and he's going to have some comments.
Hi, yes, thank you. And thank you for sharing your paper with me and the group. So I'd like to start off by tying the two papers together a little bit and how it affected me. So although polarization isn't a theme in either one of the papers, I couldn't help myself but to think about divisiveness in America right now and the polarization of the parties that are practicing government in DC. And there are several different ways to understand it, to examine it. And for these two papers, it really got me thinking about how these core American values, such as citizenship and equality, have different understandings and definitions by the two parties and the partisans in the nation. And with those two concepts being a growing difference, I believe, over the past few years, it provides a little deeper explanation of why we may be a divided nation right now. To this paper and the Congressional Black Caucus, I recognize the challenges that the authors are faced with the two crises that this caucus is faced with in 2020, one being the pandemic and the other being Black Lives Matters movement reemerging itself in intensity starting in May. And I was curious about how the authors really faced that challenge in a coding mechanism, I suppose, right? So I wondered if the authors wished to touch upon the Barbara Lee example is a great one about how we had to navigate those complex waters of collecting data, because in some instances, the member of Congress is just focusing on a Black Lives Matters movement, and in other situations, the member of Congress may be just focusing on the pandemic, and in other situations, they're focusing on both. And I find that to be a challenging minefield of data collection. And I applaud the authors for going through that. And of course, I'm curious about how these decisions were made about the coding aspect of it, I suppose. The authors mentioned in both their presentation and the paper about the gendered issues, the idea of women focusing more so on healthcare and education, for example, and their bill sponsorship and their floor speeches, and that kind of leads to some of their expectations for the modeling. And I wondered if maybe during a crisis or crises like war or pandemic, that we may have to, those expectations just wouldn't be expected. I hate to say it like that, though. Those expectations maybe not come true. It was the issue becomes so important to the national consciousness that members of Congress, male and female, wouldn't be able to ignore it. And so the leaning focus of one gender over another would be washed during those times. That's a bit of a counterfactual, I suppose, to the expectation. And if you wanted to address that, it could be relevant. Appendix B lists the members of the Congressional Black Caucus. And I think some of the more powerful data that you present is some of the simple statistics. Table 3 is a good table. I kind of learned a lot from that. So for Appendix B, when you list out the members of the Congressional Black Caucus, I was curious to know if you thought about separating those out by gender and then providing a little bit more about the mentions next to their names or the focuses next to their names, just a little bit of a count that may help provide some descriptive analysis to your paper if you so choose to go that route. I also wondered, I don't know what to make of this next point, but maybe you will. I wondered if the timing of the pandemic per state and ultimately per district had any effects towards your results, qualitative or quantitatively. So we know that New York City was hit first with the state of Washington, and then we know it took some time for it to reach places like Missouri and Indiana. So I wondered if Congressional Black Caucus members like Andre Carson and Clay from the Midwest were delayed in their content of mentioning the pandemic, while members from New York City, for example, were at the forefront of the issue. Once again, I don't know if that's an appropriate thing to model, but I just wondered if it if it may spark some ideas in your heads about that. My final point has to do with transparency. So the idea of doing a regression model, a negative binomial model, and then also doing qualitative as well, admitting a lack of significant results for the negative binomial model, but then going to the qualitative section and really providing a rich outline there. And too often those type of pieces are ignored in political science research. And I think this has a lot of value in the transparencies that the authors present the reader and showing us what the honest data shows quantitatively and then what it shows us qualitatively. And I think that could be a powerful piece for young scholars to read, right? This idea of what a quantitative piece can miss, a qualitative piece can catch. And I think that that could be a nice lesson when in grad classes, for example, of seeing the value in the different approaches to understanding some of these complex questions and complex data. So with that, I'll turn it back over to Robert. Thank you so much, Professors Brown and Strawbridge.